it's Dr. Belinda here, and we're going to talk about what to expect when your pet comes in and has a surgical procedure with us. So I understand that we perform surgeries every day here at Rouse Hill Family Vets, but for you, that's not something that you experience every day. For you, you may only experience that a few times in your pet's life, and that can be incredibly stressful for you. So I don't take for granted just how scary that experience can be for you. Now, one of the things we know is that to reduce some of the fear and the anxiety and the stress around that is to explain what's going to happen on the day in detail, and that helps to take some of the unknown away for you. So let's start off by talking about what happens the night before your pet comes in for surgery. So generally the day before your pet comes in for surgery, one of our wonderful surgical nurses will give you a call, and they will go through all the pre-op information that you need to know. So that includes fasting instructions. So generally the fasting instructions are no food after 10 o'clock the night before surgery, that they're allowed water overnight, that's fine, but to take the water away first thing in the morning. If possible, making sure that they're nice and clean before they come in, especially if they're having sterile surgery, that's also really beneficial. So if you can, in the few days before surgery, giving your pet a bath and then making sure they stay out of those lovely muddy puddles is very much appreciated. The main thing they go through with you on the phone is the fasting instructions. They will also go through with you the consent form the night before. So we like to do our consent forms remotely the night before, so that you're not having to worry about doing all that kind of admin in the morning on the day of your pet's surgery. So our nurses will explain to you the benefits of pre-anaesthetic blood testing, the reasons why we may or may not recommend laser therapy after their procedure, and also talk you through the costs so that you know what the fees are involved with your pet's surgery. And then they will send you an email or a text message with a link to the consent form so that you can fill that in at home the night before the surgical procedure. Now, the day of the surgery. On the day of the surgery, we may have prescribed what we call pre-visit pharmaceuticals or medications that help your pet to cope with the anxiety of coming into the clinic ahead of arriving in the clinic. So if you are required to give your pet a pre-visit pharmaceutical, it is okay to give them that medication in a tiny little bit of food. Okay, so not a full meal, but maybe like a little teaspoon of food, which is enough to get the medication in. So if you've got questions about that, the nurse will normally go through that with you the evening before your pet's procedure. Now, what about the morning of the surgery? What happens then? Well, when you first get up in the morning, you're going to take the water away. So they're allowed to have water overnight, but we want to take water away in the morning. And then you're going to come into the clinic. When you arrive here at the clinic, we're going to weigh your pet, and then our nurse will take you into one of our consult rooms. They will just double check again that your pet's been fasted and that they've not been unwell overnight. And then one of our vets will come into the consult room. We will give your pet a pre-anaesthetic check over, so we'll have a listen to their heart, check their gum colour, have a little palpation of their tummy, and check that what we're doing with the surgery, make sure you understand everything and answer any last minute questions that you may have. We are a little bit different to other clinics. We always like to pre-med or pre-medicate our patients in the consult room with their family members present. So what that means is you're not dropping them off first thing in the morning and then waiting around, wondering when they're going to have their surgery, and the pet's getting more stressed and freaking out in the cage and not having surgery till late in the afternoon. That doesn't happen here. The way we do it is you come in at your pet's admit time, they get pre-medicated in the room with you. So what our vets do is we give them a small pre-med injection into their back leg. Generally, it's an intramuscular injection, and normally within 5 to 10 minutes, your pet's going to get nice and relaxed and sleepy. We have a nurse that can stay with you for that entire period if you feel more comfortable with the nurse there. Otherwise, we'll generally turn the lights down low and we will step out, and there is a green call button that you can push anytime if you're worried about anything with your pet when they're getting sleepy. Now, with the pre-med, there's a couple of things to be aware of. So one is that some pets with the pre-med will get really sleepy and they'll go right to sleep. That is totally fine. There is nothing wrong with that happening, okay? Other pets might feel a little bit nauseous and get a little bit sick, and sometimes they will have a little vomit. That is okay as well. So if that happens, we just get you to press the green call button and we come in and we clean them up and we stay with them just to make sure that you're nice and comfortable with what's been happening. And then sort of the third thing that sometimes happens is they're a little bit relaxed, but they're still overriding it, and so sometimes they will need a second injection of the sedative just to help them relax a little bit more. Okay, so once your pet is nice and relaxed and sleepy, at that point, that's when we're going to collect blood if you've elected a pre-anaesthetic blood test. So we will do that once they're nice and relaxed, and when they're nice and relaxed, we can bring them out into the hospital at that stage. And at that stage, once we've run the bloods, we'll be placing an intravenous catheter so that we have IV access to your pet. So if they need any medications, or if they, and we're going to give them fluid therapy, we're able to do that straight away. Okay, so from the moment that your pet is pre-medicated in the consult room with you, we then, from that point on, once you leave, one of our nurses stays with your pet the entire time. So here we have a very high ratio of nurses to vets. So every patient that is having an anaesthetic has their own anaesthetic nurse. So their job is to purely just monitor the anaesthetic. So they're checking their blood pressure, they're checking their temperature, their heart rate, their oxygen saturation, the expired carbon dioxide. We've got all sorts of monitoring that we do to make sure that your pet is safe whilst they're under the anaesthetic. Once they wake up from surgery, we will often give them a nice little bit of extra medication just before waking up so that they're nice and pain-free and comfortable waking up. Once they're awake, we'll normally send you a text message to just let you know quickly, hey, they're all good, they're out of surgery, and to give you a rough idea of when to give us a call so that you know that everything's gone okay. And then when we get you to call back, once they're a bit more awake and we're happy for them to go home, we will book you in a discharge appointment with one of our surgical nurses who will go through any of the home care that you need to know. So that might involve going through what medication they're going home with, if there's any wound care that you need to perform at home. Generally, there's not wound care that needs to be performed at home. If they need to wear an Elizabethan collar or a little bodysuit to stop them from licking at their wounds. And they'll also go through when we want to next see them, and also what to look out for. What's something that you should be worried about, or what's something that's normal after the anaesthetic. And then we normally hand over your little fur baby for you to take them home and book in their next checkup with us. So hopefully that helps you to kind of put your mind at ease a little bit about what happens when your pet comes in for surgery and what to expect on the day. I will make some other videos up just talking specifically around certain procedures, so it gives you a bit more of an in-depth idea of what happens when it might be for, say, a female dog getting desexed or a male dog getting desexed, or if your pet's coming in for a teeth clean as well. If there's any topics that you would really like me to do a little video on, by all means, please just let me know, comment on the video or send us an email, and I will do my best to make a video for you.